So in this video, we are going to talk about the autoregulatory range of GFR and the two main mechanisms involved in regulation of GFR, which are myogenic mechanism and tubuloglomerular feedback mechanism. GFR refers to the volume of plasma that is filtered in both kidneys per minute, and that is equal to around 125 ml per minute in a normal healthy adult of an average build. We see here the Bowman's capsule, we see glomerulus, afferent arteriole, and efferent arteriole. Filtration of plasma from glomerulus to Bowman's capsule, that's what we call it GFR. GFR depends on the net filtration pressure, which largely depend on the hydrostatic pressure in the glomerulus. Hydrostatic pressure in the glomerulus depend on the renal blood flow. So if we have high pressure in the plasma, high renal flow, blood flow, that will be reflected also on glomerular filtration rate. To maintain glomerular filtration is an essential function because if GFR increase too much, that means the filtration rate will be very high, and that will cause the kidney to be unable to reabsorb and maintain essential substances like water, glucose, amino acids. And if the glomerular filtration rate decreases below the normal range, that means the kidney will be unable to excrete wastes that needs to get rid of. So what is the range for the kidney to be able to regulate its own flow? We call that the autoregulatory range. So despite wide variation in the main arterial pressure, we can see glomerular filtration rate and renal blood flow are constant. So that constant renal blood flow and the GFR, despite the variation in main arterial pressure, that's what we call it regulation. We call it regulation. It's autoregulation. Auto means the self, because the mechanisms for regulation happens locally in the kidney. This range of autoregulation from 80 to 180 millimeter mercury of main arterial pressure, which means if the main arterial pressure change from 80 to 180, there will be constant renal blood flow and GFR. There will be a local effort in the kidney to maintain GFR and renal blood flow constant. If the blood pressure becomes lower than 80, we can see here less than 80, GFR decrease, renal blood flow will decrease. Above 180, we see that, okay, that increase in blood pressure will be associated with an increase in renal blood flow and increase in GFR. So now let's look at the two different mechanisms through which kidneys can maintain its own flow and its GFR. So the first mechanism, we call it myogenic mechanism. Myo means muscle. What happened in the myogenic mechanism? If we look here, we see afferent arteriole, we see glomerulus, we see efferent arteriole. When main arterial pressure increase, what happened is there will be stretch on the wall of the afferent arteriole. That stretch on the smooth muscle here will result in a response from the smooth muscle in the form of contraction. So when the blood pressure increase and the stretch on the wall of the afferent arteriole, there will be contraction of the smooth muscle, and that will result in constriction. That vasoconstriction of the afferent arteriole will decrease the blood that is coming into the glomerulus and decrease the hydrostatic pressure and decrease the GFR. Decrease here in GFR doesn't mean that it's going to be lower than normal. No, it's going to prevent the increase in GFR, because now, okay, you have two opposing forces. You have one force trying to increase it, that is the force of the increase in the pressure. That is going to be opposed by the vasoconstriction, which prevent that increase to be reflected to an increase in hydrostatic pressure. So that is going to offset the effect of a high pressure on GFR. So that is going to minimally affect GFR. So we will be kept within normal. Will be kept within normal. The opposite happens when blood pressure decrease. So when we have a decrease in the blood pressure, this means there will be a decrease in the stretch on the smooth muscle, and there will be tendency for GFR to decrease. That is going to be also prevented and compensated by vasodilation of the afferent artery. So that vasodilation will offset the decrease in GFR and maintain it constant. This effect will be overridden in cases of decrease, like the marked decrease, as I mentioned, a decrease in main arterial blood pressure less than 80, that is going to decrease also GFR. Remember, always we have an autoregulatory range for that. So if we exceed that range, that is going to affect GFR either by an increase or a decrease based on the blood pressure, is it increasing or not decreasing. If we have low blood pressure in the circulation, we know that is going to activate sympathetic nervous system, and we know that sympathetic causes vasoconstriction. So this mechanism can be overridden by the systemic vasoconstrictor effect mediated by sympathetic nervous system. The second mechanism for autoregulation of GFR is tubuloglomerular feedback mechanism. This mechanism, from the name itself, tubulo means the tubule. The tubules that we are referring to here is the distal convoluted tubule. So if we look here at this diagram, we see the renal glomerulus, Bowman's capsule, proximal tubule, descending limb of lobe of Henle, ascending thin and thick limbs of lobe of Henle. Then we have the distal tubule. So distal tubule here, we have cells which are known as macula densa cells. Macula densa cells, they are modified epithelial cells in the distal convoluted tubule, and these cells sensitive to the sodium and chloride that are passing through in the tubule. So if there is high filtration, if we have a high GFR, that means there will be high fluid, high sodium chloride passing through the macula densa cell. Means macula densa cell will be trying to absorb more sodium and chloride here. So they sense a high filtration by sensing high sodium chloride. So what macula densa cell will do? Macula densa cells will release a paracrine signal. Paracrine signal to affect the afferent artery. Okay, what is that paracrine signal? Is the adenosine. Adenosine causes vasoconstriction of the afferent arteriole. So when we have vasoconstriction of afferent arteriole, that is going to decrease the blood entering to the glomerulus and decrease glomerular hydrostatic pressure and decrease filtration back to normal. Okay, so that is the tubuloglomerular feedback mechanism. So it's important to know the action of adenosine. So adenosine causes afferent arteriolar constriction. So that is going to decrease GFR. And adenosine also decreases the release of renin. Renin is an enzyme that is released from the juxtaglomerular cells in the juxtaglomerular apparatus, which is these juxtaglomerular cells also are present in the afferent arteriole. So these cells which release renin will be inhibited. So there will be a decrease in renin. And as we know, renin causes activation of that system, renin-angiotensin-aldosterone system. So angiotensin 2, which is in the pathway or the process of the action of renin-angiotensin 2 causes vasoconstriction of efferent arteriole mainly, and vasoconstriction of efferent arteriole causes increase in GFR. So the decrease in renin causes decrease in angiotensin 2 and subsequently contribute also to the decrease in GFR, bringing GFR back to normal. So these are the two autoregulatory mechanisms which are involved in regulation of GFR. Myogenic mechanism, which is mediated by constriction of the afferent arteriole when there is an increase in the main arterial pressure, and the tubuloglomerular feedback mechanism, which is mediated by the decrease or increase in the level of sodium endochloride based on the filtration passing through the macula dense cell in the distal convoluted tubule, and from there macula dense cell will release a paracrine signal. In cases of an increase in GFR, the paracrine signal will be adenosine, which causes afferent arteriolar constriction, decreasing GFR.